Good evening and welcome. Over the last several weeks, we've had an opportunity to speak to the director of the All India Institute of Medical Sciences, Dr. Randeep Guleria, one of the chief individuals helping to fight COVID in this country in terms of planning it and also in terms of running India's largest hospital. Lots to discuss over the last week, several developments. Dr. Guleria, always a pleasure to speak to you. My first question, sir, it's very sad that there's been the death of the head of pulmonology at the All India Institute of Medical Sciences, from all accounts a very senior and a very good human, a very fine human being besides being a doctor, also a mess worker yesterday. What exactly is there a specific problem as far as COVID and AIIMS is concerned, managing the illness within AIIMS?
So first of all, it's been a very sad day because we lost Professor J.N. Pandey. Dr. Pandey retired in 2003 as the head of the Department of Medicine and then was practicing outside. He is an AIMSonian. He joined AIIMS as an undergraduate student and then continued to be in AIIMS, did his post-graduation and then became a faculty and rose to become the head of the Department of Medicine. For me, it's a great loss because I had worked under him since I joined AIIMS in 1992, and I even knew him before that as a child because he was my dad's student, who was also the head of medicine and dean at All Institute of Medical Sciences, and therefore I know him since my early childhood days. So for me, it's a huge loss, and a thorough gentleman, a very good academician, a scientist. And he was, despite a lot of advice to the contrary, he continued to practice, considering that he was 80 years old and he's in the high risk group. And unfortunately then got the infection and then was home isolating himself, but passed away in the night.
Yeah. And the mess worker, sir, what exactly happened there, sir?
So the mess worker he works in a mess which is under a contractor. He is a cook there. And unfortunately, it's very, despite our infection control team going to all the messes and explaining to them a lot of things like hand washing, social distancing, it becomes difficult for people in this strata to really adhere to all these things strictly. And he had respiratory symptoms, but again reported late. He came in a very acute breathlessness state and collapsed in our emergency, had to be intubated and did not survive for long for us to do anything much. So again, the message, I think there are two messages that I would like to give forward from these two stories. The first message is that high risk groups should actually not take this COVID pandemic lightly and actually stay at home and be very, very careful. I would still say that you have to just stay at home, don't go out. And the second issue is, if you have any respiratory symptoms, report early to hospital. Don't delay it, no matter what be the symptom. Get yourself tested, get yourself admitted if you need to be admitted. If you come in a very advanced stage, the mortality is going to be higher. Yeah. So these are two messages which I think are driven home by these two cases that unfortunately we've had at AIIMS in the last 2 days.
Doctor, is there a larger concern about a COVID outbreak at AIIMS?
So we have had individuals at AIIMS, but what we found, and we did an analysis of this, that as a matter of fact, from a COVID hospital, which is the trauma center, the National Cancer Institute at Jhajjar, we have hardly got any positive case in our healthcare workers. But in the non-COVID area, we are getting people who are positive, and when we start tracking it, it's unfortunate that these are individuals who are coming from hotspots, from containment areas, and a large number of their family members also turn out to be positive. So our worry is that it's not AIIMS which is giving the infection, it's AIIMS which is getting the infection, because of many of our workers, especially our security guards or other sanitary workers, stay outside and they are on contract. They come from these areas and they stay in crowded facilities. And this is something that we're now doing aggressively, training them, talking to them, making sure that we give them all a proper mask, which we've been giving for the last 2 months, but making sure they use it properly even when they're at home. explaining to them the importance of social distancing, hand washing, and even asking them not to come for work. And we've actually said that if you are coming from a hotspot or containment area, just tell us. We will not insist that you come on for work, because it is for our own safety that you stay there.
Doctor, there are also incredible stories of hope in some cases at Ames and in other hospitals. Last week you were telling me about a 1-year-old child whose mother had to wear a PPE and go to see this child. Is that child okay, sir? Is that child better?
We have another child now who has the same story. That mother is negative, the parents are negative, the child is positive. The child is about 1 year old but is doing well. We've also had one child who was admitted with a complex cardiac problem and needed surgery. He and both the parents were positive. They have now become negative, and the child has now been operated and is now in the non-COVID area. So there are a lot of good stories that have come out, and what I would say is that we should not lose hope. Many patients have come out from the hospital, from the ICU. But on the other hand, there are many patients who are sick on ventilators, and it's still an ongoing battle. Yeah. And it's still a cause of concern.
Yeah. Doctor, these are questions which, as you know, we've been picking up from various people. And one of the questions which, and this is linked to the Center for Disease Control in the United States. In an article they wrote about infection from surfaces. So the question is, how likely is it for a person to get COVID-19 by touching a surface or an object that has the virus? Or it's been a while now. Do we have any better indicators?
So there's been a lot of debate, and I think the CDC article also tries to highlight that surfaces are not the only way that you can get infection. There have been studies which have looked at how long the virus can survive on surfaces, and it has varied from few hours to up to more than a day, depending on the temperature, the humidity, and the type of surfaces. But it's also been shown that these droplets can stay in the air for some time, and therefore even close contact without touching surfaces can give you the infection. So it's not only surfaces which are the cause of concern, it's also close contact. Initially, a lot of feeling was that the virus just sort of drops onto surfaces, and it's the surfaces which are the main cause. It just highlights the fact that besides the surfaces, coming in close contact with someone who is coughing, sneezing, can also give you the infection without touching any of the surfaces. So I think it's very important for us to understand that both close contact and surfaces are important, and they play an equally important role as far as transmitting the infection is concerned.
Do people treated with hydroxychloroquine face a higher risk of death compared with those who are not? There's a Lancet article on this. Your view, sir?
Correct. So there is a Lancet article which showed that in patients who were admitted with COVID-19, there was really no benefit by giving hydroxychloroquine. On the other hand, there was cardiac side effects were more in the group which received hydroxychloroquine, especially when they are given concomitant other drugs, especially drugs like azithromycin or quinolones, because they also lead to a higher chance of cardiac arrhythmias or irregular heartbeat. And therefore, it's important that those people who are taking hydroxychloroquine as prophylaxis be extra careful and consult their physician if they're taking it. Now, this article was basically looking at the use of hydroxychloroquine in patients who were admitted, who were sick. The current recommendation that we have is more as prophylaxis. And there was a lot of debate on this. We've discussed it in the past, that is it actually very useful or not? And we had always felt that we need to generate some data. Now, there is some data which has been generated both at the Ames, by ICMR, and by even the DGH, the Delhi, the central, the ministry looking at hospitals in Delhi, and by the National Institute of Virology, which has looked at viral cultures and looked at the effect of hydroxychloroquine on the virus as an in vitro experiment. All these data suggest that those people, those healthcare workers who took hydroxychloroquine, there were some who had some degree of heart problems and mild side effects, but the percentage of people who had COVID-19 infection among those who took hydroxychloroquine was less as compared to those who did not take hydroxychloroquine.
Okay.
And the lab data from National Institute of Virology also suggested that hydroxychloroquine did help in decreasing viral replication. So I think it may suggest, and I'm still wanting to see a more robust data, I'm not still saying that this is definite, it may suggest that as prophylaxis, it may be useful, but as a treatment when the virus is already replicated in the body, and now there is no point in stopping viral replication because it's already multiplied and it's already sort of there in large amount, the efficacy of the drug may not be there.
So, Doctor, the big question now, people traveling across the country by trains and flights, is it safe for citizens to fly on commercial aircraft, or should they avoid travel by aircraft right now?
So that's a tough question. I would say that any citizen who has any flu-like symptoms or has any fever and other symptoms should avoid travel. It's also very careful that if you're traveling, you make sure that everyone and you are yourself wearing a mask. Be extra cautious. There is always some degree of risk when you're traveling, and obviously whether it's a bus, whether it's train, or whether it's a flight, the degree of social distancing that one would like is difficult to maintain, and therefore you will have to take other precautions like not really even taking off your mask for a second, probably wearing gloves or washing your hands regularly, and trying to maintain as much social distance as possible. And if anyone has any symptoms, for his own protection and for the protection of the others, he should definitely not travel.
Would you recommend travel at this stage? For example, there are companies which require people to walk, just off the top of my head, but perhaps they can do without it. So if there is an option, should people avoid traveling?
So exactly. So you see, it's only if it's essential for you to travel, I would say that you should do it. If you can really manage without traveling, if you can work from home and not go to your office, then those are things that one should actually explore. And as we've been saying, that for many months, this would possibly be the new normal that we will have to accept, that unless it's essential, travel should not be done for many months to come. So traveling for, say, holidays or things like that is currently something that I will not advise at all.
Yeah. Should passengers on domestic flights be quarantined upon arrival?
So it's difficult to quarantine everyone, and if you're having passengers coming from your own country, from different zones, I think the important issue is that they should be able to stay at home. They should follow all the norms as per the government and should wear masks regularly, take all the precautions that are required. It's important for everyone to understand that more important than the travel is the sense of responsibility which each one of us has. So before travel, if you have any symptoms, don't do that. After travel, you should stay at home, monitor yourself, and take all this precaution that we are recommending, because it's not going to be possible to say that we don't do any travel as the economy opens up, as we start coming back to some degree of normalcy.
Sure.
At the same time, we have to really adhere to a lot of precautions if we want to prevent the spread of infection.
Yeah.
So I think that is the most important thing.
Is the Moderna vaccine tested in the US the magic bullet? 2 weeks back we were talking about a different magic bullet, but is this the one?
So again, it's showing a lot of hope, but like I've said before, once you have a vaccine which shows some efficacy, you have to be able to show in humans that it is forming good amount of antibodies, that it is actually forming antibodies which are in good amount and it's sustainable. A vaccine which causes antibodies and they don't last for long will not be worth it. You can't keep vaccinating everyone every month. Secondly, it has to be safe. We've had vaccines which came up 3-4 decades ago, which had to be withdrawn because they had side effects, neurological side effects. And therefore, safety is paramount, because you're going to give this vaccine to a large number of individuals, possibly who have associated comorbidities, and you can't take a chance of the vaccine causing some side effects on its own. So like we talk about drugs not having side effects, it's important that vaccines also should be safe and should be effective in terms of producing good immunogenic response in the body.
Yeah.
And then, of course, is the final question, which is always going to be a big challenge for the manufacturers, is how quickly can you produce millions and millions of doses? You will need to have a huge amount of doses if you're looking at trying to vaccinate a large amount of the population of the world or even in any country.
Yeah. Is India in stage 3 community transmission phase? Is that the phase we are now in?
So again, if we start looking at India as a whole, as a country, it's not that we are having community transmission everywhere. As a matter of fact, I would say more than 80% of our country, the cases are very few, or actually they're coming down, and there is really no community transmission in that manner. However, in our hotspots, in areas where there are a large number of cases, there is a possibility that some degree of local transmission is occurring, and that is why these hotspots, this containment zone, need to be managed aggressively. A different strategy needs to be used, because two things are very important. One is, how do we decrease the number of cases here, because they are contributing to almost 70 to 80% of our cases. And unless we could decrease the number of cases here, we will not have a decline in the number of cases. And the second issue is, how do we prevent the leakage or the spread of cases from these hotspots to other areas which are actually doing very well, and we want to make sure that we don't have other cases or clusters of cases coming up in other areas. So I think if we can do that, those are the important issues. But in these areas, there is a possibility to some degree of local transmission is occurring.
Yeah. Now, we've seen a record number of spikes in the last couple of days in the national capital, for example, in Maharashtra as well, Tamil Nadu as well as also a few other states. When will India flatten the curve?
So this is a difficult question to answer, and I think there are two things in this. One issue is as a country, and then as regions. As a country, I think it's difficult to make prediction models, because previous prediction models had shown that we may peak in May, some suggested June, July, some even suggest later on. There are a lot of variables that have to be factored in, and it's a difficult thing to say. But what I do think is that different areas may peak at different times. There are areas where the number of cases will rise and gradually come down. We had that initially in Kerala. We had an increasing number, but they were able to control it very well, and now there are very few cases in that state. Other states also, some of them have done well, and the number of cases are declining. In other areas, the number of cases are still increasing, so they will peak at different times. And ultimately, as an average, we will be able to say that at some point in time, the cases will gradually come down. It started happening in other parts of the world, but even if you look at the US, different states have peaked at different times. So I think we will go through a similar phase. When exactly we will be able to say cumulatively that the numbers have started coming down is a tough question. Yeah. It's hopefully should happen early rather than late.
Doctor, we are traveling across the country. We are on buses now in cities like Delhi. Even with 50% of people on buses, that's still a huge amount of physical proximity. And yet you can't deny people their livelihood. And yet both of us survive because of the economy. We all do. I mean, it fuels our system. So isn't this a huge conflict for you as a doctor? Your job is to save lives. You're trained to save lives. That's the basis of how you operate. And then a certain reality all around you where people are opening up the economy. How do you deal with that, sir?
So it's a paradox. I do agree with you. It's a paradox, and therefore it's an issue of trying to balance out everything. If you were to ask someone as a purist or someone who was in medicine without looking at everything else, he would have said that as an ideal solution, we continue the lockdown for a very, very long period of time, isolate everyone till the virus really goes away. But that's not practical. And as you rightly said, it has also to be balanced by how do we look at people's livelihood? How do we look at the social structure? As a society, we are also a society which is used to some degree of socializing. How do we really balance everything? Looking at other things like mental health, which is also would become an issue if you have a very strict lockdown, or providing care for those individuals who are having non-COVID related illnesses and need also to be looked after, whether it's diabetes, heart disease. So I think balancing everything out and coming out with something where you could say you're taking a calculated risk is what we're currently doing. I just hope that we are able to weather the storm as things happen, and hopefully we will not have a huge number of cases, and that would be easy for us to manage as far as the healthcare is concerned, as far as admissions are concerned, because the current data does suggest that the disease in India is relatively mild.
Yep.
Number of admissions in the hospital with severe illness is less. Very few patients are currently requiring ventilatory support.
Right.
So fingers crossed, I just hope that this pattern continues.
Dr. Guleria, always wonderful to speak to you. Thank you so much, sir, for being with us tonight.
Thank you very much.